In a seated position, sit up tall, and if you're able, move forward so that you're not resting on the back of your chair. Lengthen your spine up towards the ceiling. Imagine a string pulling the top of your head upwards. Tuck your chin, relax your shoulders and arms, and place your hands on your thighs. Begin by taking some deep diaphragm breaths. Feel these deep breaths expand your torso 360 degrees around. As you inhale, feel your lower belly and chest expand forwards. Your lower back and upper back expand backwards, and your rib cage expand sideways. As you exhale, feel your torso return to its resting state. Continue to breathe deeply. Feel your breath reach as far down as your groin. Make sure to not allow your shoulders, chest, and rib cage to elevate. Your breath should expand, not elevate. Once you've settled into a rhythm of deep diaphragm breathing, we'll work on increasing intra-abdominal pressure. Using our hands will help give us some feedback. Wrap your hands around your waist, right above your hip bone, with your thumbs on your lower back. Spread the other 4 fingers so that your index fingers are on your lower ribs and your pinky finger reaches down towards the crease of your hip. Breathe deeply and slowly into your hands, just as we did before. With your index fingers, feel the movement of the rib cage. Expanding as you inhale, shrinking as you exhale. Do both sides of the rib cage expand equally? With your thumbs, monitor the activity of the back muscles. There shouldn't be excessive contraction here. Feel the gentle tension of the back muscles as they stretch during inhalation, and feel them soften during exhalation. Do the back muscles squeeze, tighten, or strain, or are they relaxed? Is there a difference side to side? See if you can feel this. With your middle ring and pinky fingers, lightly press into your torso and feel the resistance of the abdominal wall against your fingers. Feel how this resistance changes depending on whether you're breathing in or out. Is it easy or hard to push your fingers into your belly? Is the resistance against your fingers equal on both sides? Or is one side easier to push into than the other? Keep breathing into your hands, checking in with the sensations under each of your fingers, sharpening your perception and becoming aware of subtler sensations. Make sure that your breathing expands all sections of your trunk and that you remain in your upright, aligned posture with your head in line with your tailbone. Now, on your next inhale, hold your breath for a second or two, long enough to feel the cylindrical expansion of the entire trunk, while also using your hands to gently push in and feel the resistance of the abdominal wall against your push. This expansion and resistance against the hands is increased intra-abdominal pressure. Exhale and repeat at your own pace. Use your hands to make sure you have equal pressure throughout the torso. Feel the resistance at your lower belly, the soft spots of your lower back, and your sides underneath your rib cage. You might find differences in expansion and/or resistance between different areas and from right to left side. This is normal, but it's something we want to work on improving since the goal is equal expansion and pressure throughout the torso. Oftentimes, if we have aches and pains on one side of the body, we'll find that there's a lack of awareness and connection in the core on that same side. So if there's a spot where you're having trouble feeling, focus here with the intention to expand and pressurize. And most importantly, try to label the sensations you feel in this zone. Your focused intention will improve the mind-muscle connection and your ability to perceive this area.